Hi, my name is Evan Reynolds. I'm a postdoctoral research fellow and lead statistician. Recently, I was lead author on a paper published in JCI Insights that examined the longitudinal associations between metabolic risk factors and diabetes complications, including peripheral neuropathy, cardiovascular autonomic neuropathy, and chronic kidney disease. We followed a cohort of 141 Pima American Indian patients with diabetes over time between 2013 and 2019. In each year of follow-up, they underwent metabolic risk factor assessments and diabetes complication measurements. The metabolic risk factors we were looking at included duration of diabetes, your hyperglycemia level as measured by HbA1c, cholesterol levels and blood pressure levels, and also levels of obesity. The overall goal of our study was to determine how their metabolic risk factor levels were associated with progression of neuropathy and chronic kidney disease. What we found was that these patients exhibited stable metabolic risk factors during follow-up, and despite this stability, neuropathy and chronic kidney disease did worsen over time, suggesting that stable metabolic risk factors after many years of metabolic impairment is unlikely to prevent the onset of these two complications. Ultimately, this means that we likely need earlier interventions that target important metabolic risk factors to prevent the future onset of these two morbid complications. So this study was carried out in the Pima American Indian cohort, which has been extensively studied and phenotyped over many years. This is work with our collaborator, Dr. Robert Nelson at the NIDDK in Phoenix, Arizona. Pima American Indians have higher rates and earlier onset of type 2 diabetes, which makes them an important population to study the associations between metabolic risk factors and diabetes complications over time. The Pima American Indians have long-term durations of diabetes, and so it's unclear at this point how this will extend to a general population. However, this really important cohort is going to lead to insights on how and which metabolic risk factors we target with future interventions. So the overall goal of my research is to use complex databases and advanced statistical methods to prevent and predict the onset of complications for patients with type 2 diabetes. This important study has led to insights into which metabolic risk factors are associated with neuropathy and chronic kidney disease, which will help us target future interventions that look at longitudinal metabolic risk factors.